As the president of the Kentucky Medical Association, I'm pleased to tell you that the 2019 Kentucky General Assembly was one of the most successful sessions for the KMA in recent years. Although a short 30-day session, much was accomplished for our patients and our profession. Topping off our list of successes is Senate Bill 54 on prior authorization. As every physician knows, prior authorization is an administrative burden that wastes resources and interferes with patient care, which is why the KMA made Senate Bill 54, sponsored by Senator Ralph Alvarado, our top legislative priority. Advocacy work on this legislation actually began last year and continued through the interim between legislative sessions. This legislation improves access to prior authorization information, establishes a one-year approval for chronic disease medications, enhances the review process, standardizes review times, increases access to electronic prior authorizations, and requires insurers to post prior authorization procedures on their website, as well as maintain a complete list of services for which prior authorization is required. This is a huge win for Kentucky physicians and our patients. It will take effect January 1st, 2020. Another top priority receiving passage was House Bill 11, which will enact a statewide tobacco-free schools law. The law will also prohibit the use of e-cigarettes, which are quickly becoming an epidemic as well. The KMA applauds the work of sponsors Representative Kim Moser and Senator Ralph Alvarado for their diligent work in seeing this one across the finish line. Several other pieces of legislation also received passage that will be of great benefit to healthcare in our Commonwealth. These include Senate Bill 30, which will expand coverage for genetic testing for cancer risk, as well as lower the age of eligibility for colorectal cancer screening from 50 to 45. Senate Bill 22 will allow Kentucky to enter the Interstate Medical Licensure Compact and provide an expedited multi-state licensure procedure for physicians who qualify. KMA advocacy also worked to successfully defeat legislation that could have posed threats to our patients and the practice of medicine in Kentucky. Most notably among these was Senate Bill 132, which would have expanded the prescriptive authority of advanced practice registered nurses. KMA members were instrumental in contacting their legislators to express concerns about the bill. Securing so many legislative wins in one short session isn't an easy feat. KMA was able to accomplish so much thanks in large part to the swift action of so many of our engaged members who contacted their elected officials, attended KMA's Physician Day at the Capitol, and several KMA physicians who testified in front of committees providing firsthand accounts of how legislation can impact us as physicians and, even more importantly, the patients we serve. I would be remiss if I did not recognize the outstanding KMA advocacy staff led by Corey Meadows for their timeless work throughout the session. Our success this legislative session is an example of what can be accomplished when we come together as physicians and unite around the issues that matter most to our patients and our profession. Thank you.